Final speaker before we get to our panel is Dr. Julie Chen. Another one of the common issues that people experience after head and neck cancer treatment is changes in thyroid function. And Dr. Julie Chen is a board-certified endocrinologist and clinical associate professor at Stanford University. She manages a wide range of conditions that impact the endocrine system, including radiation therapy and immunotherapy. She views her relationship with each patient as a partnership and develops a personalized care plan to achieve the best possible patient-centered outcomes. So we are really fortunate to have you here with us today, and thank you, and we look forward to hearing what you have to say.
All right, so thank you so much for the invitation to talk today, and I talk fast, and so I'll try to get us back on time. But today I really wanted to focus on thyroid function after radiation therapy. And so as Heather mentioned, I'm an endocrinologist, so first I wanted to sort of explain what is endocrinology and what are hormones. And then we'll really focus on what does the thyroid do and why it's important, particularly in this population. And then finally, we'll talk about hypothyroidism, which is low levels of thyroid hormone, and hyperthyroidism, which is high levels of thyroid hormone. All right, so endocrinology, it's a big word that basically means we study hormones and we study the glands that secrete hormones. And as endocrinologists, my goal is to replace the hormone to normal levels. So if you hear about someone, taking high doses of prednisone that you may need for your cancer treatment, or you hear about a bodybuilder taking a high dose of steroids, they're taking more than what the body needs. And our goal as endocrinologists are really, when we replace hormones, to give the body what would be considered a natural kind of hormone response. The endocrine system includes things like the thyroid gland, but it also includes glands throughout the whole body, including the pituitary gland, the adrenal glands that sit on top of the kidneys, as well as your reproductive organs. And so next, what are hormones? So hormones are chemical messengers that go throughout the whole body. So when patients come to me and they say, I feel like it's a hormone problem, what do you think? It's really hard for me to answer because anything could really be a hormone problem. But that's why as an endocrinologist, we think of ourselves as detectives, where we use kind of the hormone levels that we're able to measure to try to figure out if there's a hormonal reason for why you might be feeling the way that you are. Okay, so next, zooming into the thyroid. So the thyroid is a butterfly-shaped gland that sits in the front part of the neck, and its main role is to make thyroid hormone. Because of its location, it's very sensitive to radiation treatments and sometimes may be affected when patients are getting, neck surgery and things like that. So the effects of thyroid hormone go throughout the whole body. And so this is why sometimes when someone is wondering whether something could be due to the thyroid, it's hard for me to answer until I know what their actual thyroid hormone levels are. So I heard earlier, some concerns about, for example, memory issues. If the thyroid hormones are off, sometimes that can lead to memory issues. It can affect the heart, make the heart beat faster or slower. It can affect the lungs, where you may feel like you feel more short of breath. It can affect the digestive system, both slowing it down, leading to constipation, or speeding it up, leading to diarrhea or loose stools. It can affect the muscles in our body, making them feel more weak, and then it can also affect reproductive function as well. So the thyroid is controlled by another hormone that's called TSH. And I mainly wanted to mention this because if a doctor says, I'm going to check your thyroid or I'm going to check your TSH, this is what they mean. TSH stands for thyroid stimulating hormone. And the TSH is really the hormone that tells us what level is your thyroid hormone in the body, and does your body sense that that's the right hormone dose for you. And so TSH is always going to be in the opposite direction of your thyroid. So when you have high levels of TSH, that actually means you have low levels of thyroid hormone, because the thyroid is not making enough thyroid hormone, so the TSH, which comes from the pituitary gland in your head, lights up and starts making a bunch of TSH. And the opposite is true. A low TSH means that you have a high level of thyroid hormone. So when your thyroid is making too much thyroid hormone, the pituitary gland will shut down the TSH level. So I mainly say that because when you have labs drawn, sometimes the labs will come to you and you see them sooner than your doctor might see them. And so sometimes patients will see, I have a high TSH. Does that mean I have high thyroid hormone levels? It's actually going to be the opposite. But ultimately, I would say wait till you hear from your doctor in terms of how to best interpret your labs. Okay, so next going into hypothyroidism. So hypo means low. So hypothyroidism means low thyroid hormone levels. Now, this is just some of the symptoms that people who have low levels of thyroid hormone can report. So it includes things like dry hair or sometimes even hair loss, feeling more depressed, having dry skin, feeling fatigued, feeling muscle aches, gaining weight, constipation. Now, people, raise your hand if you have one of those symptoms on any given day, or all of them. And so this is why I really say it's hard to know if the symptoms really correlate, because these are really non-specific symptoms. The fortunate thing is if these symptoms are due to your thyroid, it can be potentially treatable, and we'll talk about some of those treatments. But I mainly say this because sometimes the issues with thyroid hormone can occur years after treatment. And so if someone's not thinking about it, they're not going to check for it. And it's a very easy thing to check for, just a blood test. And so sometimes you may have to think about it and say, I got radiation treatment, or I'm missing half of my thyroid. Should I think about my TSH? So hypothyroidism after radiation therapy. So the thyroid gland is particularly vulnerable to radiation therapy, and it can occur in up to 40 to 50% of patients who are treated with radiation therapy for head and neck cancer. The time frame can really vary from months to potentially years after radiation treatment, and there's really no consensus screening guidelines. And so I would usually say to check your TSH a couple months after your treatment. And then usually I would say check it annually if you've received neck radiation, or if you have had your part or all of your thyroid removed. And then finally, if there's any symptoms that you're concerned about and you've had some sort of, your thyroid's been impacted in any way, to always just talk to your doctor about it so that they can also be thinking about thyroid. If you are found to have low levels of thyroid hormone, it's a very treatable condition. And so it's usually going to be a pill just once in the morning. Thyroid medication is extremely safe, has minimal interactions with other medications, and has been out for almost 50 plus years. You have to take it on an empty stomach, so most patients end up taking it in the morning. We usually say 30 to 60 minutes before eating. You want to separate it from other vitamins, specifically calcium or iron. You want to check your thyroid test if you're on thyroid medication. Typically, when you start thyroid medication, it can take a couple of weeks for the thyroid to normalize. And so it may not be one of those things where the day after you start taking it, you feel, back to where you were. It can take some time. And because of that, we usually don't check thyroid labs again until 6 to 8 weeks after someone started medication. Usually, once you find what your dose is, usually you can move to checking labs every 6 to 12 months. And then I want to say, remember to hold biotin. So biotin is a very common supplement that's given over the counter. I see it sold at Costco, like right when you walk through the door. So it's one of those really common supplements, and it's used to promote like hair, skin, nail growth, that sort of thing. But biotin does not interfere with thyroid in your body, but it interferes with the lab. So it cross-reacts with the lab, and your labs will look exactly like you have high levels of thyroid hormone, but it's just due to a biotin effect. So you just need to hold the supplement 3 days before, and you should be good to go. But I just mainly want to say that because it's become such a common supplement. So that's treatment of low thyroid hormone levels. For hyperthyroidism, so hyperthyroidism is high levels of thyroid hormone. Here, think of everything speeding up. So as in hypo, everything's slowing down. In hyper, everything is speeding up. So patients can have palpitations, can have increased anxiety, can have diarrhea, unintentional weight loss, muscle weakness, feeling more irritable, changes in hair and skin and nails can also be common. So raise your hand if you have one of those. And so again, so also pretty non-specific. And so again, just always think about some of the symptoms and think about your thyroid. With that being said, very easily checked with a blood test. And as opposed to hypothyroidism, which is usually treated with a pill, hyperthyroidism after radiation therapy is usually self-limited, is that it gets better on its own. So what can happen after radiation therapy is that the thyroid can really become inflamed, and then all of the stored thyroid hormone in the thyroid gland gets released, and then it gets better on its own eventually. And so hyperthyroidism is definitely less common than hypothyroidism. It will usually occur a couple of weeks after treatment, and then will usually get better. But sometimes if patients are having a lot of symptoms, you can take another medication to help with some of those symptoms. All right, so in summary, thyroid hormone is important for metabolism. The thyroid dysfunction can occur really weeks to years after radiation therapy. Hyperthyroidism from radiation therapy typically does not need medication, but hypothyroidism is very common but treatable with a daily pill. And then lastly, I just wanted to share some patient education resources. So there you see the American Thyroid Association, or the ATA, and then on the other side, you have the American Head and Neck Society as well. So both of these are really great kind of professional societies, but they also have a lot of patient-centered, patient-focused information as well. If you go on TikTok, Instagram, there's a lot of craziness that I've seen that patients have showed me. So I would say to not go to those, but these are two really great, reliable resources that you can use in addition to your doctor as well. And so with that, I just wanted to end here and see if anybody has any questions about thyroid or other things that I can help with. Thank you.
Hello. I know a little bit about TSH. There's like a range that is acceptable TSH. It's like from 0.5 to 5.0. So my TSH before treatment was 3.5, which is in range. After treatment, now my thyroid TSH is 0.5. Still in range, but again, a big difference between what I had before at 3.5 and now I'm at 0.5. And I've talked to my primary about this. He says, well, you're in range, don't worry about it. But I'm thinking, well, before treatment, I was at 3.5. And do I have like a right to say, gee, I want to get back to 3.5, or should I just stay at the 0.5 and be happy I'm in range?
Yeah, and so the TSH is a really good measure of your thyroid function. There can be fluctuations after treatment. I usually see it go the other way as your TSH increases after treatment, but of course everybody's course is different. Say normally if you're within range, then most doctors would say to just continue to monitor. The concern is with the treatments can always potentially have side effects. And so especially for, remember, low TSH usually means high levels of thyroid hormone. The treatments that you would use to treat for hyperthyroidism can come with more side effects. And so we usually don't treat someone who has a normal, but on the lower end of normal thyroid hormone level. But I would, recommend that you continue to monitor the thyroid hormone levels. And if there are trends, over time or it becomes abnormal, then definitely would recommend talking to your doctor to discuss treatment options. All right, great. Thank you so much.